week's episode is brought to you by Support the Mountain's Herbal Parasite Cleanse. This formula targets the small and large intestinal tracts and larvae, the most broad-spectrum formula available today. 100% organic, formulated by Dr. Mikio Sankey, author of the Esoteric Acupuncture series. For 10% off your first bottle, visit shopyogahub.com and use the coupon code CLEANSE at checkout. Hello and welcome to YHTV's Magical Medical Tour. Thank you for joining us today. I'm Christina Suzuma, and with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Dr. Woolman.
And greetings to you, Christina, and greetings everyone else. Welcome to Magical Medical. This is so much fun. I'm Dr. Glenn Woolman. I will be your medical guide along with Christina today as we travel through another quadrant of the healthcare galaxy, searching for optimal health. And today we're going to be revisiting with Scott Spaulding, who has been on 2 times before. He is a gentleman who was diagnosed with colon cancer, and we'll get into his story, but we don't know what's happening, and this is what's going to be part of today's show. But before we do that, I want to thank everybody personally for nominating us for the 11th Annual Podcast Awards in our 2 categories, Magical Medical Tour and Health and Flowing into Awareness. We will be hearing soon about whether or not we actually got into the final, so everybody stay tuned. We'll send out notifications to everyone, and hopefully you'll vote for us if we get in. If you need to check, you can go to podcastawards.com. So thank you again for that, and we really do appreciate that here on Magical Medical Tour and Yoga Hub. Christina, if people want to get in touch with us, how do they do that?
Yes, thank you. Now, at any time during the show, you can feel free to ask a question, make a comment, just simply by scrolling down on your screen and typing it into the comment box. Now, if you're listening to this as a podcast, you can always pick up the phone and call us at 818-LETS-TALK, 818-LETS-TALK. Thank you, Dr. Woolman.
You're welcome. So I wanted to introduce and reintroduce Scott Spaulding. Scott, welcome.
Hello, Scott. Welcome back.
Gosh, thank you for having me on the show again. I'm looking forward to it.
Oh, yes. It's great to have you.
Scott,
it's great to be here. That's what I say.
Oh, man, you are looking great.
When people say, good to see you again, I always say now, it's good to be seen.
That's great. Scott, I want to review for a few moments and bring people up to date, and then we'll find out how things are going. So as I do that, if you have any thoughts or corrections for me, please do that. And I also want to take a moment to thank you, because one of the things that happened when we met and we started working together when you were diagnosed is that you agreed to come on the show without any knowledge of how this was going to turn out. It took a lot of courage on your part to face all of us and put yourself out there for our audience, and it's been very helpful to them. So I wanted to thank you for that personally.
Of course. It's been, I've heard from people that have watched the show, and the people that I've heard from have gotten a lot out of it. So I want to also thank you guys for putting on this show, because I think it's a real benefit for everybody all around the world.
Excellent. So basically, back in 2015, you had a couple of episodes of blood in your stools over time, and around April of last year, you went for a biopsy, and then around April 23rd or April 27th, you were diagnosed with invasive adenocarcinoma of the distal sigmoid colon. So that means kind of an aggressive cancer of the near the end of the colon. And at that time, we got together, and our plan was to get you a healthcare team, which included a hospital that you would feel comfortable in, a surgeon that you would trust and feel comfortable with, a radiation oncologist, a hematology oncologist, and a primary care doctor. Seems a lot, but we got that done. And we did our first show, which was episode 132, and that was back in August. And at that time, you then went through pre-surgical radiation and chemotherapy, and you were about to have your surgery. We did our second show, which was episode 135, and that was a great show. We did it actually when you were recovering. You were still in the hospital, recovering from the time when they took out the cancer from your colon and they gave you a new place to have your stools, which was in an ileostomy. And that's where we left off, right?
That's right. Yeah, the last show was from my hospital bed for added drama. I think 2 or 3 days after surgery.
And we've gotten a lot of hits on that show. It's been very effective, and it's helped a lot of people. I know that. So as we move forward, you then got out of the hospital, and you now had this ileostomy bag. And I want to talk about that for a few minutes, because I know a lot of people that are going to go through things that you went through are faced with that. And most of them, it's not a very appealing concept. So let's talk about the ileostomy for a few minutes. Why don't you tell us what you were thinking about before and how you dealt with it?
Well, for anyone, there's people that have had either ileostomies or colostomies, and people who haven't. And for anybody that hasn't, you obviously don't know what it's going to be like. There's a lot of mystery around it. It's definitely an unnatural situation compared to the normal biological function. And so, you don't really have expectations because you don't really know what it's going to be like. And so there's some fear, there's some mystery, there's some, is it going to be terrible? And it's definitely, my experience anyway, it's definitely something that is not as good as not doing it. Having said that, there's a lot of things in life that are like that. For me and for many people with a diverting ileostomy, which is what I had, it's designed to be temporary. And that's something, if that is the case, as it was for me, that's something that people can find solace in and say, this is something that I can deal with for 4, 5, 6, 7 months, whatever, or longer, whatever it might be. I know there's going to be an end to it, or at least that's the plan, to be able to return to sort of not normal biological function. And so for me, and for most people, there's an adjustment period of learning how to live with it, how to deal with the mechanics of it, and living life with the bag. And for me, it was there was certainly an adjustment period. For me, in my experience, there was a change of bag type, which after about a month or so of having the bag that I was given in the hospital, I changed to a different type of bag, and that was a huge improvement for me in terms of day-to-day living and quality of life. And so for anyone that's going through this, I would encourage them to do the research, to talk to multiple people, ostomy nurses, physicians, to talk about different types of products to see what might be the best fit for that person, because there could be, as there was for me, room for improvement. And so towards the end, I had it for about 7 months, and towards the end, it was something that I was able to live with day to day without a tremendous amount of quality of life impact. Having said that, there was definitely a quality of life impact for me, but it was something that turned out to me to be manageable.
Yeah, that's a very good point. And I think this is something, a takeaway for a lot of people, is that, you go through the process and the doctors tell you this is the bag, they put it on, the ostomy nurses say this is the bag, and as a patient, you say, okay, this is it. And if there are complications, you just say, that's acceptable because this is what they told me. But taking the reins yourself and becoming the patient as the CEO, as one of our other shows talked about, looking into other possibilities and seeing if you can improve it. So you did improve that. Did you, when you were out and about in public, did you ever start wondering, you're out there with your bag and nobody really knew that you had that. Did you ever start wondering what other things people might have had around you at different restaurants or walking around? Who else had an ostomy bag, or who had something else, a catheter inside, or anything else?
I did at times. Considering that there were certain, towards the end, when I was a little bit more healthy after my chemotherapy treatment had ended, and I was a little bit healthier and able to go out into public, into the public. I did wonder that a little bit about certain people because people couldn't necessarily tell that I was wearing a bag. However, I didn't focus on that, considering that it's a little bit of a rabbit hole, wondering what other people might have or not have or be going through. You know, it's sort of an endless thing that you could think about in terms of, you know, what other people might be experiencing or might be facing.
You also had something that we didn't talk about much. You had a port put in into one of your blood vessels right under your collarbone or your clavicle right at the initial surgery, and that stayed with you for many months. That was to draw bloods and sometimes to give you medications. How was it dealing with that all the time?
You know, for me, dealing with the port, it's very common for people that are going through chemotherapy and other types of treatments. For me, it wasn't, compared to the fact that I had a bag, it wasn't really any impact on me at all. There were certainly aspects of it that were more convenient, so they didn't have to tap into my arm for things like hydration or medication. And so that was certainly convenient. It wasn't terribly noticeable. It does lie underneath the skin. And so, you know, for me, compared to everything else that I was going through, really not a big deal.
So let's talk about what you were going through. So now you finished the pre-surgical chemotherapy and radiation therapy, and that wasn't too bad. You had a few little episodes of things going on, but you survived through that, and you had your surgery, and now you had your ileostomy, and now you were faced with more chemotherapy, no radiation, but the chemotherapy, they told you it was going to be a little more intense this time. So tell us a little bit about the chemo and your experience with that.
For my chemo regimen after surgery, they give you typically the standard regimen is about 6 months of chemotherapy, and so I had about 6 weeks of that while I was going through radiation. So I had about 4.5 more months of chemo following surgery. It started about a month after my surgery, and for me, the second round of chemo was a 2-drug combination. One was the same drug that I took while I was going through radiation, which was pill-based, which is to say it's convenient. You can do it at home. And the other drug was a much more powerful drug that was going to be once every 3 weeks for a total of 18 weeks for 6 sessions. And, 2-hour intravenous, as is the more common chemotherapy. And I actually only made it through 2 of those because of the side effects that I had with that particular drug. That drug had much more significant side effects on me personally. And given the fact that there was a marginal benefit, according to my oncologist, for not just that drug, but also this post-surgical round of chemotherapy, he decided that it was advisable to not continue with that particular drug. I did continue with the pill-based drug for another, 4 months.
When you say complications and side effects, give us some examples of that, please.
The more powerful drug, which was oxaliplatin, that I was on, had I had an allergic reaction to the drug. It had one of the side effects of that is sensitivity to cold, whether it's cold air, or cold liquids, or whatever it might be. Don't put your hand in the refrigerator. Don't touch cold things. Don't go outside without gloves and a mask on. Don't breathe in cold air. When I got home from the second intravenous drug session for that one, I had a sip of room temperature water, and my throat swelled up to the point of restricting probably 95% of my airflow for, probably 2 or 3 minutes. It slowly got back so that I could breathe. But when my mouth and throat was swollen and I couldn't speak very well for the remainder of the day. When my oncologist heard that, he thought that it was advisable to probably not continue with that. But there were other aspects of that drug. Lost my appetite. I didn't have nausea or vomiting, at least to that point after the 2 sessions. But I did lose quite a bit of weight, had no desire in eating, and there was some fatigue as well, for sure, with that drug.
Did you ever get hospitalized for anything?
I was hospitalized after about 6 weeks. That was due to, we're not quite sure what it was due to. It was dehydration, which is a very common side effect of the pill brace drug that I was taking. So I had about 5 or 6 weeks after I started the second round of chemo, I had 3 trips to the ER. I had 2 hospitalizations. One was for about 5 days, and it was just for dehydration. So they had me hooked up to an IV. The body was just trying to get rid of everything inside, and it was. I turned out. I learned after that it was actually more serious than it seemed at the time, because I felt like I was hooked up to an IV and my fluid was being replaced. But my oncologist did say later, after I had recovered from that it was a more serious situation than I knew at the time.
Would you have liked to have known that at the time, or was it good to find out afterwards?
It was probably better to find out afterwards, because I'm not sure that you can do anything with that information other than worry, and worrying and stress is not helpful to the recovery process.
Okay, so one of the things that we didn't mention right now is that after they did the surgery on you, where they took out that part of your colon that had the cancer in it, and they took out some of the lymph nodes, what did the biopsies or the pathology show of that surgery?
The surgery that I had, and to sort of give you a sense, I had surgery in September of 2015, where they took out part of the colon and part of the rectum where the tumor was, including the margin, and they ended up taking out 9 lymph nodes. I think they tried to shoot for around 12, but as a function of the radiation process, there were several lymph nodes that were just destroyed, and so they weren't able to be removed because they weren't there. But they did take out 9 lymph nodes, and obviously they test those to see if the cancer has spread to those. In my case, I was very fortunate. The cancer had not, but there was no evidence that the cancer had spread to those 9 lymph nodes that they removed. And so that was obviously great news for me. And you don't know that until they're able to take those lymph nodes out and test them. I remember a physician was telling me sort of early in this process that one of the things that, doctors know a lot, and I realize I'm speaking with the doctor now, but doctors know a tremendous amount of information, but there's an even much larger amount of information that doctors don't know. And one of the things that medical technology and this sort of state of healthcare right now does not allow for is to know whether lymph nodes are impacted by cancer, by the spread of cancer, without removing them from your body. So one of the physicians that I was working with said, 20 years from now, we might be able to tell you that whether the cancer is in your lymph nodes without having to cut you open and take them out and test them. But we're not there yet. And that would help with the staging, and and that knowledge would help with the treatment. We're obviously not there yet, and that's the way it is now. But I think that's something that's sort of important to remember is doctors don't necessarily know everything, and there are certain things that need to be tested for and processed to be able to provide additional information. But there are going to be plenty of times when information is just not going to be attainable as part of treatment or a process.
That's why Christina and I do the show. I know most of the medical stuff, and she knows everything else, right, Christina?
Well, at least I take a good guess.
All right, so now you're having your chemo, you finish your chemo, and we're getting ready to take you back to surgery. Any preparation for your surgery where they were going to close up the ileostomy and put you back to normal and reconnect you? How did you prepare for that?
One of the things that I did for both of my surgeries, and I would certainly recommend this for anybody that's going through any kind of medical treatment, is to try to position yourself for the best possible outcome, whether it's surgery, whether it's chemotherapy, or any other kind of medical treatment. And that can be done on a number of different planes. The mind, body, spirit way to approach it is certainly something that I have found to be very effective for me. One of the things that I did in particular was try to get my body in as good of shape as possible to try to be as strong as possible for surgery. Surgery takes a lot out of you. Whenever it's an impact on your body, and so if you can get your body to the point to get it to be as reasonably as strong as possible, you're going to recover more quickly. You're going to endure the impact on your body better. And so, getting your body physically in shape is something that I concentrated on, in addition to the mind and the spirit part. Meditating, trying to meditate, trying to reduce your stress level, thinking positively about the surgery itself and about what will happen after the surgery. So, sort of on all those fronts, I approached both surgeries in the same way.
Beautiful. I think that'll be very helpful for a lot of people. So you had your surgery and you came out of it. How did you recover from this surgery?
Well, my doctor, my surgeon, who I had a tremendous amount of confidence in, very, very, very happy with, said I should plan to be in the hospital for 2 to 4 days. Obviously, I was thinking more 2. It ended up being 4, which was okay. But considering I had major surgery in September, this surgery was on April 1, April Fool's Day, 2016, and I. To bookend the previous surgery, which was on 9/11 in 2015. So I'm picking good dates for my surgery.
Amazing.
There wasn't a problem getting an operating room, I think, on either one of those 2 dates. So,
No.
but they, the second surgery I had was less complicated and a little bit more simple than the first one was, and I had very good results with the first one, so I had confidence going into the second surgery. And there was also this great outcome of not having the bag anymore as a result of this particular surgery. That's the whole point of it. And so I was looking forward to it. You had to wait. I think I waited 4 weeks after the end of my chemotherapy to have the body recover from the impact of the chemotherapy. And so it was, I had confidence going in and I had a good outcome.
Beautiful. So at this point, you are considered cured and cancer-free?
Well, there's no evidence of cancer. Obviously, with any kind of cancer, you have to monitor the body for 3, 4, 5 years and make sure that it's not lurking somewhere in your body. And I'm certainly aware of that. And you do regular testing and you do a scan, I think once a year or once every, 8 or 10 months, something like that. So I'm in a situation now, like most cancer patients following treatment, where you wait and you see and you monitor the situation. A friend of mine has had colon surgery about 8 years ago, and so he's in that post 5-year stage, which is where I plan to be 4 years from now.
Excellent. One of the things that we don't talk about, and I think this would be very interesting, is that when you're going through the process and you have the diagnosis, you have a mindset, there's a lot of fear, you have the cancer, you're trying to get healed from it, you go through the chemo, radiation, surgeries, more surgeries, and then you have your final surgery and you're healed, essentially, and you have that mindset of healing that you've been dealing with for a year now. How do you shift from that mindset of healing into moving forward?
Well, I'm glad you brought that up, because that's one thing that I did not see coming. When you're in treatment, how I approached it and how I would encourage others to approach it is that you're on 24/7. So you are concentrating on trying to affect the best outcome that you can have, regardless of what your treatment is. If it's chemotherapy, if it's radiation, if it's surgery, if it's, whatever it is, you are every day thinking about how you can have the best outcome from this. So when you're on the radiation table, you're welcoming that into your body because it's going to heal you. So throughout the entire treatment process, preparing for surgery, whatever it might be, in my case, it was about a year long, you're thinking about and concentrating on positive outcomes and preparing for that positive outcome. When I realized that what was symbolic for me to represent the end of treatment was when I had my first post-operative visit with my surgeon on the second surgery, and he removed the staples that I had for the incision. And I realized after that, the next day, that my treatment was over, because I'm going to meet with doctors periodically and I'm going to have the scans, but it's in a monitoring situation now, or a monitoring phase. And now what do I do with that concentration and that energy that was previously focused on my treatment and trying to have the best outcome possible with that? What do I do with that energy now? And I'm still going through that adjustment period right now. It took me a little bit by surprise, because I woke up one day and I realized I don't have to do that anymore. I'm not taking pills. I'm not going to the radiation lab. I'm not preparing for surgery. I don't have to do X, Y, and Z that I've been doing for the past year. And so I'm in the process now of sort of pivoting to the future in terms of taking care of myself and making sure that I'm going to maintain this level of health following the end of my treatment. So that's one thing that I would encourage people to at least be aware of that are going through treatment, is that's the treatment at some point is going to end, and that's a good thing. But try to think about what's going to happen after that in advance if you can.
Scott, that's really magnificent, how you've held on to such positive energy, and I'm sure that that's really helped you progress through all this. I have a question which comes up quite often with others that I know that have been diagnosed with cancers, etc. What happens when you inform others of your situation? And I'm sure you've had an array of reactions. Can you share with us how you would approach those different reactions when you inform people of what you're dealing with?
That's a great question. We went through a very painful process at the beginning of this. When we learned of the diagnosis, we had to tell our friends and family, and it was a painful process to do. You obviously have to do it. My opinion, people handle this question differently, because I've seen people who have been diagnosed with cancer and they tend to try to keep it to themselves, or they don't want attention, or sometimes they don't even want people to know about it, which is foreign to me, because people are going to find out and people want to help, and you're going to need help. Help is going to be beneficial to anybody going through treatment. So, telling people it's an uncomfortable and difficult process. It's best to do it with a partner or a spouse if you have one. That's critical, in my opinion. That's certainly been my experience. But as far as telling people in general, my philosophy is honesty is going to benefit you in the long term. Certainly in not only in life, but in how you face what's in front of you. And so, your friends and family are all around to help you, being honest with them and being direct and saying, there's a lot I don't know. I've just been diagnosed. We don't know what the future is going to be, but here's what I know, and I know I can count on you.
Lovely. Thank you.
Scott, is there anything you would have done differently looking back?
Great question. There's some things there are probably some things that I would have I don't know that I would have done them differently, but I should have done them differently. And for me, diet is always a challenge. I don't have the greatest diet, and I know diet is extremely important, but I still don't necessarily honor that issue. But nutrition is extremely important. I think I had a tremendous partner in my wife Cindy going through all of this, and so she was making sure that we were both doing the I don't want to necessarily say the right thing, but the best thing that we could at whatever particular time it was. So I think that we handled our case pretty well in terms of the decisions that we made and how we approached all of that. I certainly took advantage of your assistance, and I would encourage anyone who's facing a diagnosis of cancer to, learn as much as you can, and I like the analogy of being a CEO of your own treatment. That's great. You own it. It's yours. The patient is the one that makes the decisions. In order to make decisions, you need to know as much as possible to be able to make the best decision for you as the patient. And so there's a very there's a very common reaction to simply do whatever the doctors tell you to do and not get a second opinion. I don't subscribe to that. I think that as a patient, you need to be an educated patient. And I think we were. So I think there's probably, little things that along the way that we probably could have done better. I think with anything, I think probably rest and relaxation and trying to reduce that stress level is one thing that we could have probably done some improvement on. But I think in general, I think we were fairly happy with how we navigated the whole process.
Yeah, I would second the part about Cindy. Everyone should have a Cindy in their life. Scott, we're coming to the end of the show, and this will be your third health tip. I wonder if the pressure of a third health tip is more difficult than having your ileostomy revised.
I wouldn't go that far, but I will say that I sort of gave some thought to how I can help others in this particular situation. And we've talked about the importance of maintaining a positive attitude. We've talked about the importance of having approaching this on all different a number of different planes. I think and maintaining a sense of humor. I think the one thing that perhaps I haven't said enough yet is to embrace and accept and take advantage of all offers of help that are going to be coming to you as a patient. Friends and family are going to want to help you, and it's in your interest to take advantage of those offers. So, if someone wants to cook a meal for you or bring food over or run an errand for you, let them do that. And don't be ashamed of it, and don't be embarrassed by it. This is something that is going to be good for you. Other people are happy to do that. And for whatever reason, our American, sense of independence might get in the way of trying to not only take advantage of those offers of assistance, but negatively impact our health because of it. And so that's sort of a small tip, but something that I think is really important to keep in mind is to take advantage of all offers of help that come your way.
I think it's actually a big tip. Scott, when we first met, you had told me that just before this diagnosis, you were planning on an adventure abroad, and you had to cancel that. And I promised you at the beginning of our work that at some point you'd be making another plan. Do you have another plan?
Well, we had a trip planned to Africa. We were going to leave about 2 weeks after I got diagnosed, so we had to cancel that. But this summer, a year later, we are going to be going to spend some time both in Amsterdam and about a week or so in the south of France. So that's going to be in July at the height of the tourist season. So we are very much looking forward to that as a little bit of R&R after this year of treatment that we've been through. And we're looking
Beautiful.
forward to that for sure.
Excellent.
Beautiful, full circle. I'm grateful to our very special guest, Scott Spaulding, for sharing with us through this amazing journey. And I know his journey will help other people on their journey. I would also like to thank all of my teachers and healers for bringing me to the place I am today. Thanking you, Yoga Hub and Christina and Segovia, for putting Magical Medical Tour together. And I look forward to getting together again on Magical Medical Tour with all of you as we explore another quadrant of the healthcare galaxy. Thank you very much, Scott. And until our next meeting, I wish you all optimal health.
Yes, thank you so much, Scott, for sharing your courage and really your experience in this journey. It's been magnificent, and you have touched many lives. Many of the people that I know, you have touched their lives, and we're all grateful for your time and your energy and your positive thinking. And of course, Dr. Glenn Woolman, thank you for a wonderful show, and to each and every one of you for joining us in this new platform of education and information. We're grateful for your continuous support, and we look forward to hearing your feedback on how we can serve you better. We would like to, if you would like to connect with Dr. Glenn Woolman, you can do so through his website, glennwoolman.com, where we encourage you to learn about his Metaphor Square Breath. And of course, do follow him on Facebook at The Medical Guide. Now, if you have questions or comments for our wonderful guest, Scott Spaulding, please simply leave your comment or question. You can type it in or call us here at Yoga Hub at 818-LETS-TALK, 818-LETS-TALK, and we will be sure to get your message over to Scott and have a reply for you, hopefully. Okay, so take care, and thank you so much to everyone again for your nominations, and we look forward to your support. Please subscribe to our channel on YouTube, like us, and share what we're sharing with you. Thank you so much. Until next time, namaste.
Between 80 to 90% of the people in the world today in the 21st century have this problem of candida overgrowth. And, what has led to, it's the 21st century with antibiotics, chlorinated water, too much carbohydrates, too much sugar, too much yeasts and sweets, that has created this overgrowth within us of candida that leads to a plethora of problems that is really a common denominator between